Hello everybody, welcome to my YouTube channel. My name is Bernard Herschel. I am a specialist for HIV and AIDS and the chair of the Research Ethical Committee in Geneva. If you are interested, there is a link towards my CV and publications at the end of this video. I'd like to share with you a familiar experience. You are at a medical conference in front of a poster with an interesting title, several tables, 25 unfamiliar acronyms, and 32 arrows going in all directions. You are just about to give up and head for lunch when you spot the friendly first author who explains in 5 minutes what it would have taken you 25 to decipher by yourself. Now, the best medical journals publish figures which can be just as complicated as the posters. For instance, consider this illustration from the New England Journal of Medicine. Problem is, no friendly author in sight. Instead, you have to rely on the legend. Do you have the motivation, energy, and stamina to go back and forth between legend and figure until you understand everything? I certainly don't. It's outdated technology, like traveling by horse and buggy. What follows is an imitation of what a friendly author could do. Enjoy, and don't hold back with criticisms and suggestions. Let's start by seeing how this figure is organized. From top to bottom, we have the bronchial lumen, the bronchial epithelium, and intracellular events. From left to right, there is type 2 high asthma, panel A, and type 2 low asthma, panel B. Within type 2 high asthma, we further distinguish between allergic asthma, with frequent onset in childhood, and adult onset eosinophilic asthma. The inflammatory pathways of type 2 high inflammation, type 2 high asthma, panel A, or type 2 low inflammation, type 2 low asthma, panel B, drive severe asthma. Type 2 high eosinophilic airway inflammation is present in allergic asthma, most frequently in childhood onset asthma, and in adult onset severe eosinophilic asthma, which is less often associated with aeroallergy. On exposure to allergens, pollutants, viruses, or bacteria, airway epithelial cells release alarmins, i.e. epithelial cytokines, such as interleukin 25, 33, and thymic stromal lymphopoietin, TSLP. The pathways involved in type 2 high asthma differ among patients. The pathway in allergen-sensitized patients is outlined in yellow. The pathway in adult onset eosinophilic asthma in green. In allergen-sensitized patients, myeloid dendritic cells present inhaled aeroallergens, for instance house dust mite, animal dander, or pollen, together with co-stimulatory molecules to tissue-resident memory CD4+ type 2 helper T lymphocytes, expressing antigen-specific T-cell receptors and responding in an allergen-specific manner on activation. In adult onset eosinophilic asthma, alarmins released by epithelial cells activate type 2 innate lymphoid cells, ILC2, which lack antigen-specific TCRs, but express receptors for these alarmins and leukotrienes. Both Th2 cells and type 2 innate lymphoid cells, ILC2, produce high amounts of the type 2 cytokines interleukin 4, interleukin 5, and interleukin 13. Interleukin 4 plays a key role in the differentiation of naive CD4 T cells into Th2 cells. Interleukin 5 promotes the proliferation and differentiation of eosinophils from bone marrow eosinophil progenitors, prolongs eosinophil survival, and activates eosinophils which release cysteinyl leukotrienes and toxic granules, causing tissue damage, aggravating chronic airway inflammation, and leading to acute exacerbations of asthma. Interleukin 13 induces expression of the enzyme inducible nitric oxide synthase, INOS, in epithelial cells, leading to an increase in fractional exhaled nitric oxide, FeNO. Interleukin 13 also elicits mucus hypersecretion and stimulates contraction of airway smooth muscle cells, causing bronchoconstriction. Interleukin 4 and interleukin 13 play an important role in recruiting eosinophils from the blood circulation to the airway mucosa, both directly by enhancing the expression of adhesion molecules on endothelial cells and indirectly by eliciting the production of chemokines such as eotaxins by epithelial cells. Through eosinophil extracellular traps, Charcoliden crystals, and eosinophil peroxidase-generated oxidants, airway eosinophils mediate mucus plug formation and contribute to chronic airflow obstruction in type 2 high severe asthma. Type 2 low asthma encompasses paucigranulocytic asthma and neutrophilic asthma. Type 1 helper Th1 and type 17 helper T, Th17, CD4 plus lymphocytes may stimulate neutrophilic inflammation through tumor necrosis factor alpha, TNF-alpha, interferon gamma, interleukin 6, interleukin 17A, and CXCL8. The alarmins TSLP and interleukin 33, the latter activated from full-length interleukin 33 by mast cell-derived tryptase, may be involved in the crosstalk between mast cells and airway smooth muscle cells, contributing to airway hyperresponsiveness. Therapeutically useful monoclonal antibodies are tezepelumab, directed against thymic stromal lymphopoietin TSLP, dupilumab, directed against the IL-4 receptor, which is also the receptor for IL-13, omalizumab, directed against IgE, reslizumab and mepolizumab, directed against IL-5, and benralizumab, directed against the IL-5 receptor.